The Ruby Princess set sail from Sydney's shores months ago, but the COVID catastrophe she brought is still sending ripples through government. A special commission of inquiries heaped blame on New South Wales Health for wrongly assessing the ship as low risk, despite more than a dozen passengers displaying flu-like symptoms.
Can I now apologise unreservedly?
But New South Wales health officials weren't even there when the Ruby Princess came dockside on that fateful day in March. The ship instead met by officers from two Commonwealth agencies, Border Force and Agriculture.
The national protocol was not followed.
The Agriculture boss admitting a biosecurity officer relied entirely on the New South Wales health advice and didn't do her own checks.
That impacted very severely on many people.
Border Force has never had legislative authority over human health reports, but a senior officer showed strong interest in sick passengers isolated in their cabins.
He was, I think, simply trying to be helpful.
The officer sought and received lab forms filled out by the ship's doctor, but misinterpreted them, thinking they showed the isolated passengers had tested negative to coronavirus, when in fact they'd tested negative to the flu. After assuring superiors the isolated passengers had tested negative, he gave the go-ahead for them to go straight out, according to the government's own submission.
If he'd understood that the COVID results were still outstanding, what would he have done differently?
Well, that's a very hypothetical question, Senator, because they're not.
You just raised it, though.
Had, of course, the officer become concerned for any reason, then they would have made a phone call. The issue would have been elevated if there were concerns.
The Special Commission cleared Border Force of responsibility for the Ruby Princess disaster. But had the ABF officer properly understood the lab form and then sought advice, as Michael Outram says he would have, the isolated passengers might not have been allowed to disembark. This doesn't absolve New South Wales Health for its catastrophic errors, but it was among a litany of mistakes that led to 11 feverish and infectious people carrying the virus across the country. Andrew Probyn, ABC News, Canberra.